Welcome to Crisis in Perception, where we examine the systems shaping our world. This is the deep dive.
This deep dive is part of our ongoing Creators in Context series. We're focusing on how contemporary thinkers interpret, adapt, and sometimes completely reframe complex ideas.
Yeah, and how those ideas move across time, different institutions, different kinds of media. We're really interested in the people who are doing more than just reporting facts. They're actively translating, really technical, specialized knowledge for a much broader audience.
And our anchor creator for this one is Dr. Jessica Knurick. A lot of people know her as Dr. Jess. She's a PhD and a registered dietitian nutritionist, and she's built this huge audience, something like 400,000 followers on TikTok.
Over 11 million likes, which is just staggering. And her work, it's so much more than just food logging or sharing a recipe. It is, at its core, a political and structural education on public health and the U.S. food system.
It really is. And the sources you provided give us a fantastic way to frame her work. We're using her critiques, which are so sharp and consistent, and we're setting them against two key conceptual scaffolding sources.
The first one is this document called the Uncompromised Dietary Guidelines for Americans from the Center for Science and the Public Interest and the Center for Biological Diversity.
Right. And the second is more of a conceptual framework. It's the idea of information filtering, specifically from Herman and Chomsky's manufacturing consent.
And we should be really clear here, we're not doing a deep dive on media theory. We are strictly using these concepts as a lens to understand how scientific consensus can get so distorted as it moves into the public sphere and, into actual policy.
Exactly. So our mission today is very, very precise. We are looking at how Dr. Knurick translates and defends evidence-based public health in an environment where policy, media, and frankly, profit incentives just systematically warp what we all receive as official health advice.
We're looking at that gap, like the space between what the science says, what the government policy actually implements, and then the public story that results from that, which is often just complete confusion.
Total confusion. And a crucial point, we are not here to give you nutritional advice.
No, absolutely not. We leave that to the experts like Dr. Knurick. We're here to understand the structural context that makes it so hard for anyone to follow any evidence-based advice in the first place.
And Dr. Knurick provides that missing link. She gives this detailed systems analysis that explains why scientific recommendations so often get ignored or softened or sometimes even flat out contradicted by the very agencies that are supposed to be promoting public health.
So when you really dig into her content, what stands out almost immediately is this relentless focus on causality.
Yes.
She is just so successful because she spots the common gaslighting that happens to consumers. She almost never talks about individual choices or, moral failings. It's always about the powerful structural forces that create this hostile food environment we're all living in.
That's the absolute core of her critique. She's naming the architects of the system. And when you look across her videos, the critique isn't vague. It's incredibly specific. She's not just using buzzwords. She's naming the policies that got us here.
Things like agricultural policy, trade policy.
Exactly. The very specific way commodity subsidies are given out. Weak antitrust enforcement that allows just a few giant companies to control everything. Marketing rules that target kids.
Labor policy even.
Labor policy that keeps wages down. And this just constant drumbeat of deregulation that's designed to minimize corporate costs and liability.
Let's pause on those commodity subsidies for a second, because that's something she comes back to again and again. She presents them as this engine of distortion.
They are.
The government isn't just, passively funding farms. It's actively funding the very systems that make unhealthy options cheap and everywhere.
And this is where the policy directly undermines public health. She points out that most of those subsidies go to corn and soy, and that corn and soy, it's not primarily ending up on your plate as, corn on the cob or edamame. It's being fed to farmed animals, which fuels the cheap production of red and processed meat. Or it's refined into these super cheap, super profitable ingredients.
Like high fructose corn syrup.
High fructose corn syrup, cheap vegetable oils, all the building blocks of ultra-processed food.
So what you're saying is the government is handing out massive financial incentives that make the ingredients for unhealthy food profitable. The very things that the scientific consensus, the DGAC she cites, tells us we should be limiting.
It's a completely perverse incentive. It creates a market where the cheapest, most available calories are almost always the most nutrient-poor ones.
And it becomes this self-reinforcing loop. And that framing, That structural framing lets her shift the whole debate away from "you need more willpower" and towards "we need policy accountability."
Exactly. And she pushes back so hard on this common media story that, the science is always changing.
Oh, that drives me crazy.
Her argument is that the undermining of scientific consensus happens, not because the science changed, but because industry groups systematically lobby and fund campaigns to get weaker standards. It reduces their costs and maximizes their profit.
When we see that pattern everywhere, she connects it beyond just food. She'll highlight an administration rolling back, say, environmental safeguards.
Like soot pollution standards or protections for wetlands, yeah.
And her point is explicit. These rollbacks aren't because of some new evidence that says pollution is safe now. They're the direct result of political pressure from industries that want to reduce their operational costs.
By doing that, she shows it's a pattern of behavior. The policy machinery, she argues, makes it easier to justify actions that serve corporate interests, whether that's big ag or big oil, by deliberately sowing doubt in the evidence itself.
Because if the public doesn't trust the science, they won't demand regulation.
And the industry is free to operate without those costly safeguards.
This structural lens is, I think it's at its most powerful and visible when she defends programs that are constantly being used to misdirect blame. And the big one is the Supplemental Nutrition Assistance Program, or SNAP.
Her defense of SNAP recipients it's a central part of her work. It's a very sharp, very deliberate corrective. She understands that SNAP is always the scapegoat.
Right.
And her core point is just undeniable. SNAP did not build the current food environment. It didn't fund the explosion of ultra-processed foods.
Okay, so let's introduce a little friction here, because this is the counter-argument you always hear. If there are studies showing that the average SNAP household buys more processed food or sugary drinks than a non-SNAP household, doesn't that imply that there is some personal choice or, maybe an education gap involved? How does she handle that?
She tackles it head on by immediately putting it back in the context of policy and economics. She argues that data showing higher purchases of processed food reflects the constraints of the system, not a moral failure or a lack of desire to eat healthy.
So people on SNAP are just trying to afford the groceries that are already available.
They're trying to afford the groceries that are already available and aggressively marketed to them in this rigged for-profit system.
So if the cheapest, most calorie-dense, most heavily subsidized food is ultra-processed, then of course a family that's constrained by poverty or time or living in a food desert is going to rationally choose the cheapest options.
Exactly. The personal choice is secondary to the economic reality. She identifies this whole effort to link SNP with poor nutrition as a manipulative messaging strategy.
And the manipulation works on two levels.
Right. First, it protects industry profits. It preserves the architecture of the for-profit food system. But second, and this is the crucial part, it redirects all the blame onto low-income families themselves.
Which then makes it politically easy to justify cutting the program.
And the real architects, the policymakers, the corporate lobbyists, they're completely shielded.
That reframing is so essential. It tells you, don't look at the person buying the cheapest thing on the shelf. Look at why that product is the cheapest and why the healthy alternative costs 5 times as much.
And she extends this critique beyond just food. She applies the same systemic lens to bigger healthcare failures.
Like the undervaluing of certain professions.
Exactly. The undervaluing and underfunding of non-profitable care-based jobs, nurses, social workers, mental health counselors. They are critical to public health, but they're hard to scale into these massive, quarterly profit-driven corporate machines.
She even points to specific policy actions, like that bill she called the Big Beautiful Bill, which cut hundreds of billions from Medicaid.
Right, resulting in millions of people losing their health insurance and threatening to close hundreds of rural hospitals.
And then she zeroes in on the narrative deceit. She calls out the attempt to reframe these tiny token offsets in the bill, these little pilot programs, as a historic investment in rural health care.
It's a classic tactic. It's designed to mask the massive structural harm of the budget cuts with these small, politically appealing little gestures. It distracts the public from what's really happening.
What's so fascinating to me is how seamlessly she moves from the nutrient density of vegetable to the politics of Medicaid cuts. For her, they're not separate issues.
No, they're all expressions of the same underlying design failure. It's a policy architecture that prioritizes corporate profit, deregulation, and resource extraction over fundamental public well-being.
Whether that profit comes from selling ultra-processed food or from denying health coverage.
She unifies the critique. The systems that create cheap, unhealthy calories are the same systems that defund community health infrastructure. It all points back to one central organizing principle: profit maximization for a few at the expense of the health of the many.
So this structural problem that Dr. Knurick is diagnosing, it comes into incredibly sharp focus when we look at how science is supposed to become policy through the Dietary Guidelines for Americans, the DGA.
Right. And the source material on the DGA shows this recurring, totally predictable pattern. The scientific evidence is gathered, but then institutional incentives compromise the public guidance that comes out at the end.
The DGA isn't just a pamphlet, right? It's a legally mandated document.
That's right. Every 5 years, Congress requires the USDA and the Department of Health and Human Services, HHS, to publish guidelines that reflect the preponderance of scientific and medical knowledge.
And that process starts with the Dietary Guidelines Advisory Committee, the DGAC. This is a panel of top experts. They review thousands of studies, and they draft this massive scientific report.
And that report should inform, if not basically dictate, the final DGA. But the key failure point, as organizations like CSPI point out, happens when the final document from the USDA and HHS diverges from the science-based recommendations of the DGAC.
The science is gathered, the experts make their report, and then political choices are made to soften the guidance.
Almost always to protect economic interests. And this is where that broader systemic critique of neoliberalism becomes, well, essential context. Without it, the filtering of the science just looks like random incompetence. With it, it looks like intentional design.
Okay, let's slow down here and define what we mean by that. Neoliberalism, as a political economic idea, isn't just small government. It's an active policy program that says private interests, being corporations, should control as much of social life and public infrastructure as possible to maximize their own profit.
Absolutely. And within that framework, policies that massively favor corporations, like industry-specific deregulation, big tax cuts for the wealthy, corporate subsidies, they get defended as just, the free market at work.
The ideology demands what our sources call an almost religious faith in the infallibility of the unregulated market.
But the market, as Dr. Knurick constantly points out, isn't unregulated at all. It's administered by the government to benefit very specific private interests.
Exactly. The state doesn't just disappear in this model. It just changes its job.
It changes its function. Governments start lavishly subsidizing corporations, protecting them from competition or from labor or environmental rules. And crucially, they work to limit public debate to these, minor issues.
Like individual consumer choice.
Right. The fundamental control of business, the structure of the food supply itself, is considered off limits to popular deliberation or change. And so public health becomes secondary to the profits of the food industry.
So when Dr. Knurick makes entire videos breaking down agricultural subsidies, she's identifying exactly how the state is actively protecting and promoting private, profit-driven interests in the food sector.
Often in direct opposition to the public health science that the DGAC is trying to uphold. The government is basically acting as the enforcement arm for corporate profitability.
And that leads us right to the core ideological weapon of this whole architecture, the personal responsibility trap.
This is the narrative you hear all the time.
All the time. If everything is the result of a perfect free market, then any bad outcome, poverty, obesity, chronic disease, it must be the fault of the individual, your lack of willpower, your poor choices.
That's the function of the ideology. It emphasizes personal responsibility to rationalize policies that actively make inequality worse. It shifts the blame for policy failure directly onto the victim.
And Dr. Knurick is explicitly fighting this. By focusing on consolidated corporate power, the fact that, just a handful of companies control the entire meat industry or the seed industry, she shifts the blame away from the consumer or the SNIP recipient and puts it back on the policymakers and the industry they serve.
She politicizes nutrition. She insists that these outcomes are not moral failures. They are structural political failures that have to be addressed with policy changes.
Things like strong antitrust enforcement, getting rid of those perverse subsidies, demanding scientific integrity.
She makes the structural constraints visible.
It's such a vital reframing because it challenges the whole premise. If the unregulated market is perfect, then any attempt to introduce public health regulations that might cut into profit, like limiting red meat or curbing aggressive marketing, is automatically framed by the industry as, anti-freedom or bureaucratic overreach.
Right. And Dr. Knurick exposes the myth that the market is free when it's being actively subsidized and administered to favor these specific unhealthy outcomes.
Okay, so we can move from that theoretical context to the concrete evidence of this filtering process. And we can do that by looking at this document, the Uncompromised Dietary Guidelines for Americans, 2025-2030.
This document from CSPI and the Center for Biological Diversity is a real-world artifact. It shows the filtering process in action.
It's so powerful because its purpose was just remedial. It was designed to show the public what the guidelines should have looked like if the government had just followed its own legal mandate to publish guidance based on the preponderance of the evidence.
It's the unfiltered science laid bare for everyone to see.
And the comparison shows exactly where the political pressure hits the hardest. I mean, the most glaring, politically charged example is alcohol consumption in the 2020 guidelines.
The scientific advice from the 2020 DGAC was strong, it was consistent, it was unequivocal, it was based on a mountain of evidence linking alcohol to increased health risks.
And specifically, the DGAC recommended that the limit should be up to 1 drink per day for both women and men.
For both. This was a science-based recommendation to reduce cancer risk, it's linked to 7 types of cancer, and to decrease all-cause mortality even at so-called moderate levels.
And yet, the final official 2020 DGA, it just completely ignored this.
Completely ignored it. It maintained the much more lenient, older limit of 2 drinks per day for men and 1 for women. It was a clear policy choice to just maintain the status quo, to soften the public health message despite clear, compelling evidence.
And then it got even worse. The institutional response went beyond just softening the guidance. When the next DGAC decided not to review alcohol, they deferred to other expert committees. One of those key reports, a draft from HHS, was then never finalized.
And why wasn't it finalized? The CSPI critique notes it was because of substantial industry lobbying and interference from Congress.
That is the direct paper trail evidence of power interfering with science. The alcohol industry used its political and financial leverage to stop a government report it didn't like from ever seeing the light of day.
That is the filtration model in real time. The scientific truth gets blocked by the exercise of concentrated power, and the public guidance ends up favoring corporate profit, in this case, alcohol sales over basic public health.
So moving beyond alcohol, the Uncompromised Guidelines highlight how this filtering happens with major food groups. The recommendations from the DGAC were so much stronger and more direct, especially about animal products and processed foods.
Oh, absolutely. Let's get into the specifics of what the DGAC science actually recommended that the policymakers tend to soften or just omit completely. Well, the DGAC strongly advocated for dramatically increasing intake of plant-based proteins. So beans, peas, lentils, nuts, seeds, soy products. And critically, it included explicit language to decrease intake of red and processed meat.
And that specific language, decrease intake of red and processed meat, that is exactly what gets softened or just disappears in the final DGA.
Of course it does, because the USDA, one of the 2 departments in charge, has this dual mandate. It's supposed to promote the health of Americans and promote American agriculture,
Which relies heavily on beef and pork.
So those 2 mandates are often in direct conflict.
And you see a similar thing with grains, right? Another massive commodity market.
Yes. The recommendation was to significantly increase intake of whole grains to at least 3-ounce equivalents a day, and at the same time, decrease refined grain intake to less than 3 a day.
Those are specific, quantifiable, evidence-based targets. They're designed to move the American diet away from cheap, nutrient-poor, refined products.
But by omitting or just weakening those specific targets, the final guidance becomes really vague. It just says something like, eat less of some processed food without actually challenging the massive subsidized systems that make those refined grain products so cheap in the first place.
Now, the DGAC did try to simplify the messaging for consumers. They recommended consolidating the 3 existing dietary patterns, the healthy U.S., Mediterranean, and vegetarian, into a single flexible model called Eat Healthy Your Way.
And that was a good move toward clarity. It reflected the strong evidence that all healthy dietary patterns share these core features, fruits, vegetables, whole grains, legumes, while still allowing for, cultural or economic differences.
Well, sure, but the core critique still stands. Even with a clearer pattern, if the policy architecture is actively making the wrong foods cheaper and more accessible, then the guideline itself is just this distant aspirational goal, not a realistic tool for most people.
And finally, there's the elephant in the room that the official DGA mandate couldn't even touch: sustainability.
Right. CSPI and the Center for Biological Diversity explicitly added a fifth guideline, Guideline 5, which policymakers consistently suppress entirely.
And they're allowed to suppress it because the DGAC's mandate is currently focused only on human health. It prevents them from incorporating environmental science, even when the health and environmental recommendations are perfectly aligned.
So what does Guideline 5 say?
It directly links diet to planetary health. It advises prioritizing plant-based proteins, limiting red and processed meat because of the massive environmental impact of production. Water use, land degradation, greenhouse gases making tap water your primary drink to reduce plastic waste, and minimizing food waste.
That omission is so revealing. It shows you the political line in the sand. Wherever the science suggests a policy that might economically restrict or change the structure of big ag or meat production, that scientific advice is either suppressed entirely, like with sustainability, or it's heavily softened, like with red meat.
It clearly shows that health science is secondary to maintaining the economic viability of a few powerful industries.
So this entire complex system, the rigorous DGAC science, the USDA and HHS policy softening, the documented industry interference, this is the necessary backdrop for Dr. Knurick's work.
Yes, she recognizes that just presenting the raw science isn't enough. She has to provide the translation and the structural reframing to fight the distortion and the confusion that results from all this.
And her most important move, the reason her content connects so strongly, is how she counters that insidious personal responsibility narrative, especially around programs like SNAP.
She uses the context of this highly distorted food system to prove why that narrative isn't just wrong, but it's intellectually dishonest and politically manipulative.
She explicitly names the structural factors: the decades of subsidies, the massive corporate consolidation, the regulatory environment that favors extraction.
And then she carefully defines SNAP, not as a cause of poor health, but as a mechanism. A nutrition assistance program that helps low-income families afford the groceries that are already available to them in a system designed for profit.
That immediately shifts the blame. By saying over and over that the system is already rigged by specific policy choices, decisions made in Washington, not in the grocery aisle, she makes it clear that blaming poor people for their health outcomes is a strategy.
It's a strategy to deflect criticism away from the industry that profits from the rigged system and the policymakers who enable it. It's political gaslighting.
And she backs this up with analysis of corporate consolidation. She critiques administrations for being so committed to giving tax breaks and free government-sponsored marketing to big food corporations making candy, soda, and ultra-processed food.
Let's linger on that phrase, free government-sponsored marketing. What does that actually look like?
Well, it's a lot of things. It's the implicit support of subsidies that make corn and soy derivatives cheaper than real food. It's permissive labeling laws that allow for confusing health claims.
It's weak antitrust enforcement, which lets these huge conglomerates control the whole supply chain and push out smaller, healthier competitors.
So when the government actively chooses not to regulate these systems, that inaction acts as a massive subsidy and marketing tool for these high-profit, nutrient-poor foods.
It makes them cheaper and more accessible than the nutrient-dense options the DGAC is desperately trying to promote. That is the core policy failure.
The government is actively incentivizing the opposite of its own health recommendations.
And this approach lets her assign causality structurally. It makes these complex public health issues understandable. For example, she'll point out that decades of research consistently show that diets high in saturated fat raise LDL cholesterol and increase heart disease risk.
Right.
So when policymakers push guidance that ignores this strong, science-like softening the language around saturated fat, she frames it as harmful advice that will almost certainly make population health worse.
The message is clear. The resulting heart disease isn't just a consequence of bad choices. It's a predictable, structural outcome of policy failure and industry capture.
So her solution is, therefore, inherently structural and political. It's not just about telling people to manage their stress or eat more vegetables.
No.
It's about demanding changes to the systems that constrain those people. The solution, in her view, is adopting the evidence-based guidelines and improving the food environment and public health policies so those guidelines are realistic for people to follow.
That just flips the whole neoliberal idea that the market must decide on its head. She's arguing public health must dictate policy, not corporate profit.
She understands that if the environment is hostile, if healthy options are too expensive, if you live in a food desert, if giant corporations control everything you see and buy, then the individual is fundamentally constrained. Her work is a call for a political economy based on public health and cooperation.
To really understand why Dr. Knurick's message is so necessary, we need a quick conceptual tool. We need to understand the mechanics of how information gets distorted in a profit-driven system.
And this is where that idea of filtration, from the propaganda model described by Herman and Chomsky, is really useful.
Again, just as a conceptual shorthand.
Exactly. The model traces how concentrated money and power are able to filter out information, to marginalize dissent, and to make sure that dominant interests get their preferred messages across. In this context, the raw material of science, that DGAC report, has to pass through these filters before it becomes the official DGA or a mainstream media story.
And what's left is what our sources call the cleansed residue fit for policy.
Right. And we can apply two of these filters directly to the food policy context. The first is advertising and profit orientation.
So in any system that relies on corporate money, the goal of maximizing profit means that policy and news have to avoid anything that might offend the primary patrons.
In the DGA context, those patrons are the massive, consolidated industries built around red meat, dairy, refined grains, alcohol.
So if the DGAC, following the science, says strictly reduce red meat and strongly advise against alcohol, that directly threatens billions in corporate revenue.
And so the USDA and HHS, as institutions that are responsive to political pressure, they soften, they omit, they bury that guidance to avoid challenging those power structures and facing political backlash.
The second relevant filter is the reliance on experts and the use of flack.
Mainstream media and policy debates, they rely on experts who are often funded and approved by these primary sources of power industry-funded think tanks, for example. And this skews the entire supply of public expertise.
And anyone who challenges that gets targeted.
That's where flack comes in. Corporate interests use flack, systematic attacks, PR campaigns, legal threats, to discipline anyone who challenges their narrative. We saw it with the industry lobbying that killed the HHS alcohol report. That is the exertion of flack to suppress unwanted science.
And Dr. Knurick, with her PhD and her RDN credentials, she acts as a kind of dissident expert.
She provides the highly respectable, authoritative view that because it exposes the policy failures of big food and big ag, it often gets marginalized or attacked in the mainstream. She's performing this essential counter-response to a deeply ingrained filtration system.
So why is she using TikTok? I mean, a platform known for its speed, its short formats, its viral dances, to disseminate these incredibly complex, systems-based critiques.
She's intentionally leveraging the platform to break through that traditional media filter. Traditional media, which is owned by these huge conglomerates, has largely eroded the space for real public debate. It's been replaced with what our sources call a depoliticized consumer culture.
So she's using TikTok's algorithm to build an alternative, politically engaged public sphere around food and health policy.
And her content, even though the source material is so complex, I mean, you have to explain decades of policy failure in under 3 minutes, it's so concise and politically pointed. This compression forces her to focus on the core mechanism, who benefits, who pays, and where the policy lever is.
And that compression is essential for it to go viral and to fight the gaslighting that's inherent in the official sources. If the government says one thing and the science says another, she resolves that dissonance by exposing the structural contradiction.
She's delivering these systems-based arguments to an audience of almost 400,000 people who are clearly hungry for this kind of detailed, policy-focused analysis.
And the comment section on her videos just validates this. Users aren't just saying, I agree. They're echoing the structural critique. They're demanding policy action.
You see comments like, they don't create the food system, they respond to it. That shows a high level of systemic understanding. Or, you belong in a policy-making position, which shows her audience sees her work as inherently political.
And that engagement shows this shared political consciousness that's happening outside the mainstream. The audience is connecting the dots between their own daily struggles, affording groceries, being confused by health advice, and the structural corruption she exposes.
Like the shame directed at SNAP recipients while giant corporations that don't need the handout get these lavish subsidies.
There's also so much frustration directed at traditional media. We see comments like, I need these reporters to start calling them out on their non-answers.
Yeah, that highlights a profound awareness that established journalists are often failing to hold power accountable.
So this digital platform is functioning as this critical information space, outside the immediate control of the commercial interests that dominate the typical media landscape.
She is actively creating a political public sphere where issues like deregulation and corporate subsidies are openly discussed and understood as policy failures,
Mm.
instead of being simplified into these depoliticized consumer choices that just make people feel bad about themselves.
She is navigating this huge challenge of delivering nuanced, evidence-based critique in a space where political debate tends to get simplified very quickly. But by focusing on the political economy, who has the power, who gets the money, she creates this powerful, sticky narrative that just cuts through all the noise.
So let's synthesize what this relentless conflict between the evidence from the DGAC and the compromise policy from the USDA and HHS really means for you, the average person trying to navigate public health advice.
Because what Dr. Knurick is trying to do is clarify this massive public confusion and this deep-seated institutional mistrust.
The confusion is totally predictable. When official guidance from the USDA contradicts decades of strong scientific consensus, like the 2-drink limit for men or telling people to eat more saturated fat, it just creates these wildly conflicting messages.
And the public, when they get these conflicting messages from what look like authoritative sources, they draw the logical conclusion that the science is always changing, or all experts are corrupt, or, nothing really matters, so I'll just eat what's cheap and tastes good.
And that nihilism is incredibly profitable for the food industry.
But Dr. Knurick provides the clarification. She explains that the conflicting messages are not random or accidental. They're not because of scientific incompetence. They're completely understandable when you look at them through the lens of political economy and policy capture.
The policy is designed to serve private interests, to protect big ag profits, not public health. And that divergence is the source of the contradiction.
And we have to contrast this so strongly with the moral narrative of health.
Yes.
This narrative, which you see perpetuated everywhere, insists, if you are poor, if you are sick, it is because you make bad choices, you lack willpower. And that framing successfully rationalizes policies that make inequality worse, and it prevents any kind of structural reform by making you focus inward.
But Dr. Knurick offers the structural political economy view. Your health outcomes are constrained by policies that actively subsidize and promote unhealthy options, while simultaneously undermining the scientific guidance you are told to follow.
And that's the aha moment for so many people. The problem isn't your own personal failure or lack of discipline. It's intentional political design. It's weak enforcement, targeted subsidies, and the deliberate political softening of scientific consensus.
This shift in perspective is so crucial because it moves health from being this personal, individualized failure to being a collective political responsibility.
The systems shaping our food, our agriculture, our healthcare, they are not natural. They're not inevitable. They are the result of conscious policy choices.
And that reinterpretation is a powerful form of political education. Dr. Knurick is essentially showing that social change requires more than just better individual behavior. It requires a realistic assessment of existing circumstances and ultimately organized political activism to challenge those policy choices.
The implied call to action is not just to change your grocery list. It's to reorganize the power structures that dictate what's even available on that list in the first place.
Her work exposes this fundamental hypocrisy of the system. Corporate interests are perfectly happy to rely on the government for huge subsidies, protection from competition, and suppression of critical science.
But they demand that the public should be left entirely to the mercies of the free market when it comes to social benefits, safety nets, or protective health regulations.
So this deep dive brings us to a really clear central finding about the crisis in perception around food and health. What we consume as nutrition advice or official guidelines, it's not a pure scientific truth.
No, it is a highly contested product of institutions. It's mediated, it's softened, and it's often severely compromised by concentrated profit motives and political pressures.
The process is laid bare. The DGAC gives us the scientific truth, based on the evidence. The USDA and HHS provide the politically palatable version that won't disrupt major corporate stakeholders. And the Uncompromised Dietary Guidelines exist precisely to show you the massive gap created by that political filtration.
And Dr. Knurick exists as this vital corrective. She acts as an authoritative, dissident expert who leverages digital platforms to bypass the traditional media filters, which are themselves increasingly centralized and dependent on those primary sources of corporate power.
Her strength is in making the structural connections undeniable. She draws a direct causal line from profit over people, which is expressed through these perverse agricultural subsidies and massive corporate consolidation, to the inevitable result.
Which is deteriorating public health, confusing policy, and rising chronic disease rates. She's demanding accountability from the principal architects of policy, whom critical political economists have long identified as the powerful classes using state power for their own private gain.
So to leave you with a final provocative thought, let's revisit this concept of consent without consent in the context of food policy.
This idea, which was originally applied to imperial control, suggests that institutions can impose plans that are rejected by the public policies that knowingly compromise health and the environment, if they believe that the stupid and prejudiced masses will eventually just heartily consent to what has been done once the system is entrenched.
So if the policies around our food, the subsidies for unhealthy options, the intentional softening of clear scientific advice on alcohol, the omission of sustainability data, if they compromise public health for the sake of profit, are policymakers operating on the principle that the public must just submit to this architecture until we eventually consent to the system we're forced to live in?
And how does that ideological posture dictate which forms of information, like the clear, science-based, uncompromised guidelines, are even allowed into the mainstream public debate?
That concludes our deep dive into creators in context, crisis in perception.
Our thanks to Dr. Jessica Knurick for her essential work translating rigorous public health science into structural critique and making policy failures visible to a mass audience.
We credit the Center for Science in the Public Interest and the Center for Biological Diversity for creating the Uncompromised Dietary Guidelines for Americans 2025-2030, which serves as such a powerful mirror to institutional failure.
And we thank Edward S. Herman and Noam Chomsky, whose work in manufacturing consent provided the conceptual scaffolding we use to analyze the mechanisms of information flow and political filtration in a system driven by concentrated power.
Consider the filtering mechanisms in other areas of your informed life. Which scientific consensus is being softened by policy? Whose profits are being protected by the resulting public confusion?
Join the ongoing crisis in perception conversation, seeking out sources that provide critical context rather than just consensus.
Thank you for listening.